Sorry. That's okay.
I was in my meeting with Nikki.
Oh, okay, yeah, no, we haven't started yet.
They're waiting for me to start.
I think there's a moderator's gonna get started. They're on, yeah. Okay. So.
Yep, we'd like to go ahead and kick this webinar off. Thomas, Andrea, who would like to get started first?
Well, I think actually we're going to start with a couple of remarks by Jess Farb, who is the director of this work.
Hi there, everybody. Thanks for your interest in our project here. So as you all probably are aware, this is a mandate that GAO worked on, and the team is a bunch of experts on health IT, so this is my first exposure to working with them on this particular topic. And I think you probably know the overall questions, which Tom's kind of going to get into, but essentially, we've done a lot of work in this area, and this is sort of the most recent work that we've done. And patient matching is kind of a difficult issue, I think, as our report sort of indicates. And so we'll be interested in hearing some of your thoughts about what we found and what we learned. That's all I have.
Okay. All right. Well, thank you, Jess. Yes. And one general comment I wanted to add to what Jess said is that in doing our health IT work, we've actually spoken with a number of WEDI members in the past, and we've very much appreciated your willingness to talk with us and the insights you've provided. And who knows when we might come knocking on your door again. But to jump into this report, the 21st Century Cures Act included a provision for GAO to review patient record matching efforts in the context of electronic health records. So for this study, we focused on patient matching that takes place when providers exchange information rather than that occurs within an office, matching patients within a single practice. So to do this work, we described the patient matching approaches used by organizations that we spoke with and the related challenges they identified. And we also, the other objective we focused on was efforts to improve patient record matching identified by ONC and other organizations we spoke with. So to do this work, as I just mentioned, we started by reviewing published work, and we looked at reports by the Office of the National Coordinator, and as perhaps all of you know, within HHS, ONC is responsible for coordinating nationwide efforts to implement electronic health records and other health IT systems, often using patient record matching. But we also interviewed a range of stakeholders that we identified through background research and from input from other stakeholders, and we also had people reach out to us when the mandate was passed, which we appreciated. So, and then these included representatives from healthcare providers, physician practices and hospitals, health information exchange organizations, health IT vendors, organizations that represented providers and health information management staff and health IT vendors, other individuals, and then of course ONC. And we also talked to HHS's Agency for Healthcare Research and Quality. In total, we conducted 37 interviews with stakeholders, and although we spoke to many stakeholders, we always note that the information we obtained from the stakeholders is not generalizable to other stakeholders. So I don't know if anyone had any questions about that before I jump into our discussion of our work. I guess not. Maybe we'll say that till then. Yep. So, of course, the first thing we had to do is think about, what is patient matching? So, we talked to many people, and we can, determine that patient matching is a process of comparing patient information in different health records to determine if the records refer to the same patient. And we noted the importance of accurate patient record matching, that, obviously those records include lab results and past diagnoses, and it's critical for quality of patient care. We also noted the type of, the impact of inaccurate record matching. We saw that really there's two ways that patient records are inaccurately matched, either through a false positive, which can present safety and privacy concerns, or false negative, which can affect patient care. So we and many others have reported that patient record matching is a challenge. So in general, we found in doing our work, and Andrew's going to give us a little more information about this, but patient matching relies on demographic information such as patient's name, date of birth, sex, social security number, or address, among other information. And many different types of organizations are involved in patient record matching. Healthcare providers, health information exchanges, and health IT vendors. So with that, I'm going to turn it over to Andrea. I'll mention that Robin Berg was the analyst in charge of this work, and she at the last minute was unable to join us today. So we appreciate Andrea's willingness to step in and take her place. So with that, Andrea, I'll hand it off to you.
Great. Thanks so much, Tom. So in the course of doing our work, like Tom described, we talked with stakeholders. We also obviously reviewed relevant reports in this area. And what I'm going to go through is I'm going to touch on the real key things that we learned during the course of talking with stakeholders, because I think that's where the real meat of this job is. So in our first finding, we talk about how stakeholders we interviewed described the methods that they use for patient record matching. And these really fell into one of three areas. We had some providers that we talked with that were using manual approaches, such as when a staff member would manually match records. In some cases, stakeholders described using fully automated approaches where they relied on algorithms that were embedded in the electronic health record system. And then in some cases, the stakeholders we talked with described using a hybrid approach where they would start out with an automated method and then on the back end do some manual matching to sort of remediate any matching issues. Most of the providers that we spoke with said that they sometimes use the services of health information exchange organizations to exchange and match records. But what was interesting there was that none of the providers that we talked with relied solely on an HIE organization as their primary means for exchanging health information and matching records. Stakeholders that we spoke with also noted that it is difficult to determine the accuracy of the health IT tools that they were using for patient record matching. Specifically, they did not know in many cases, or in any cases, how many matches an algorithm was failing to make. And HHS noted that the proprietary nature of many patient matching algorithms makes it difficult to assess their effectiveness. The stakeholders that we talked with also noted that the inaccurate, incomplete, and inconsistently formatted data that makes up patient demographic data can often pose a challenge with patient record matching. The stakeholders that we spoke with stressed the importance of using quality demographic patient data for matching patients' records. And they noted that when the demographic information is wrong, incomplete, or inconsistently formatted, this is what makes patient record matching so difficult. The stakeholders that we spoke with described how providers collect demographic information and how they collect it can sometimes add to the issues that they run into when matching patient records. So for example, some providers may collect a social security number or a mother's maiden name while others do not. Sometimes labs in particular will not collect complete information, and that will make matching difficult when lab information is then sent back to the provider. Stakeholders described that the inconsistency in the formatting of demographic information is really being this key issue when it comes to patient matching, and not all systems are using the same formatting standards for things like patient address, patient name, handling special characters within a patient's name or a phone number. It was also noted that not all systems handle missing data in the same way, again, adding to this issue of matching patients' records. And then finally, the stakeholders that we interviewed noted that matching for some patient populations is more difficult than others. So for example, newborns, children who are a part of multiple births, names from cultures that have different naming conventions or formatting, and the naming for transgender patients are all posing unique patient matching challenges when matching patients' records. The other thing that we did in the course of this work that was really interesting was we talked with stakeholders about the efforts that they've undertaken to improve demographic data and methods to use to match patient records. And some of the stakeholders that we talked with described a number of efforts they were undertaking to improve the consistency when recording and formatting patient demographic data in their electronic health record systems. So for example, we talked with a group of providers in Texas who in 2017 implemented standards for how staff should record patients' names, addresses, and other demographic data to improve and facilitate data exchange. And one of the really interesting things about that effort, as we talked with the stakeholders involved in it, was that the representatives estimated that that effort alone had reduced the need to manually match records by up to 90%. A children's hospital that we spoke with in a separate effort was working with other local hospitals to set a standard for naming convention for newborns. And the staff that we talked with also reported that this resulted in an improved ability to match newborn records pretty significantly. Other efforts that are ongoing or have been undertaken around patient record matching include Pew's recent study to measure how standardizing specific types of demographic data can affect patient matching. According to Pew, their findings of their work have indicated that standardizing demographic data, such as address, shows the promise for improving patient matching. And during the course of our work, as many of you know, we also spoke with officials from WEDI as well as Pew to learn about different efforts that were being looked at to use smartphone applications or mobile phones to help verify patients' demographic information. And what was interesting about that is both organizations noted that while these efforts show promise for helping address this particular issue, these issues around patient matching, it's really also important to consider the practical implications of using such tools, such as whether providers would be able to access the data, whether patients would be willing to use them, and also as well taking into consideration security concerns that could arise when using these types of applications. Stakeholders at ONC also described a number of recent or ongoing efforts to improve the effectiveness of patient matching methods. These efforts include ONC's Patient Matching Algorithm Challenge, the recent Sequoia framework, an ARC study that is running through 2022 that is looking to evaluate patient record matching approaches with the goal of identifying different approaches that could improve the accuracy of patient matching, as well as Chime's National Patient ID Challenge. The stakeholders we interviewed also identified additional efforts that ONC and others could take to improve patient record matching. These efforts, I think the primary one that we heard about was implementing a common standard for recording patients' demographic data in health IT systems. And stakeholders noted that this could be helpful, but they had differing views on how to reach an agreement and implement common standards among providers. So, for example, some stakeholders we spoke with wanted ONC to establish those requirements around demographic data, particularly like using the EHR certification process, whereas others thought that it should be developed and implemented by the industry. And yet others felt that it should be more of a hybrid approach, with ONC playing a role in getting industry groups to agree and implement common data standards. And some of the stakeholders we interviewed noted that the efforts to implement a common data standard could result in some challenges, such as difficulty in reaching consensus across industry organizations, needing to take into account patient preferences, so patients not always being willing to provide certain types of demographic data, the time that would be required for providers to train staff on how to collect data in accordance with new standards, or staff not consistently following those new standards, variations in how EHR systems collect data, and finally, standards not maybe fully addressing or preventing inaccurate or outdated patient information. Several of the stakeholders we talked with also noted that it would be really helpful for there to be a standard data set that organizations could use to evaluate patient matching methods. Particularly a data set that would allow them to assess patient matching methods independently instead of relying on the information provided to them by vendors on the accuracy of different algorithms or systems. And ONC interestingly agreed that this is a challenge, but they pointed out that developing such a test data set presents a number of challenges, including the need for such a data set to be very large and for it to be able to mimic real-world patient data. And particularly, this is a challenge because patient populations differ at a regional level when it comes to patient matching. And so such a data set might end up having a very limited application and might not be able to be used, for example, across the United States. The stakeholders we interviewed also felt that more could be done to encourage the sharing of best practices around patient matching resources. So some examples include bringing organizations together to share lessons learned and collaborate on best practices, or disseminating information around patient matching errors to help organizations better understand the causes of patient matching errors. And obviously, this wouldn't be a patient matching report if we didn't talk about a national unique patient identifier, and that definitely came up in a number of discussions. And a number of stakeholders that we spoke with noted that implementing such an identifier really could improve patient record matching However, a number of other stakeholders also pointed out or expressed doubt that such an identifier would ever be implemented, and some cited potential limitations that such an identifier could have. So, for example, such an identifier would still be subject to manual data entry errors, data breaches, and could be used in cases of fraud. So it would not address those challenges that come into play with regard to patient matching. Some of the stakeholders noted that patients might be willing to voluntarily adopt a unique identifier that could be used across healthcare settings to help match their records if such an option was available, which we thought was an interesting point. Multiple stakeholders that we talked with saw the need for a collaborative public-private effort to help identify and implement efforts around improving patient record matching. And this could be in the form of ONC convening stakeholders or playing more of a leadership role in this area. ONC officials, on the other hand, noted that while they don't have the resources to support the broad implementation of an effort to improve patient matching, they have collaborated with stakeholders on various issues related to patient matching in order to help address some of the challenges around this topic. ONC and some stakeholders noted that ONC's efforts to establish a national framework for exchanging health information electronically is a potential opportunity to address patient record matching challenges. So, as part of their efforts to address requirements in the 21st Century Cures Act, ONC, as many of you probably know, has issued a draft trusted exchange framework and will be undertaking additional efforts in this area. But with regard to that, stakeholders felt that ONC's efforts in this area would only improve patient matching if it results in new guidance or standards specifically around demographic data. So that is the conclusion of the highlights of our findings. I guess it's probably a good time to see if anybody has any questions.
Thank you, everyone. We do have a few questions that came in during the registration process. I'm going to go over those first. Has using outside referential matching processes significantly improved match success rates?
Are you going to...
you ready to take that, Tom?
Well, I mean, unfortunately, if you're looking at the video, you might have seen a smile. So that one of the things we really focused on is ways in which people are doing matching and some of the challenges being faced and ways that it could be improved. But we did not do any work looking at success rates or particularly success rates over time. So, and we have not continued to monitor this issue, once we, issued this report. So, I think that's my long-winded way of saying we don't know. That was really beyond the work we did. I don't know, Andrea, if you want to add anything.
Yeah, it's noted in the point that some of the stakeholders we talked with did discuss using referential matching approaches. The thing that was brought up, though, in the context of referential matching was specifically around it not being ideal for every population. So, for example, referential matching might work great with an adult that has a lot of established data in a variety of databases, but obviously a newborn doesn't have a credit history. So, or at least we hope they don't. So those are the populations in which referential matching just isn't ideal. And so it can pose a challenge in populations where, for example, if you're a children's hospital or you have a very large homeless population, those are some examples that we heard from people that we interviewed where it might be problematic.
Thanks for that. Another one, what's the role of master data management solutions in identity resolution?
We did not look at that in the course of our work, so I really can't speak to that.
Okay, we can go on to the next question. What did you find during your research regarding industry interest and support for a national patient identifier?
I couldn't specifically divide it by industry, but like I noted that a number of the stakeholders we talked with said that a national patient identifier could potentially resolve some of these issues, but it doesn't come without its challenges. And it wouldn't address all of the issues around patient matching. So data entry would still be a problem with a national patient identifier. You'd still have issues with potentially with fraud. So it was really sort of a mixed bag in that area. I will note that a number of people we spoke with said both of these things in tandem. So they would say, yeah, this would be great. It would potentially solve this issue of patient matching, but so I would honestly say it was a very mixed bag with regard to a unique national patient identifier.
Now we've got some questions, some live questions coming in. Make sure if you're on the live webinar, if you have any questions, type them into your questions box in your GoToWebinar control panel and submit them so we can get them answered. First one, did you encounter consistent errors in the type of matching errors? For example, date of birth recorded in different ways, like date, month, year, one place, and month, date, year at another. If there are similar errors found, could this be an education effort for the industry to highlight the problem and adopt a consistent approach?
That's a good question. So we, like Tom pointed out, we didn't actually look at specific patient matching error rates or anything of that nature. I will say that, however, in interviews with stakeholders, there were a lot of consistent themes with regard to the pieces of demographic data that they were finding challenging with regard to formatting, and it was also very consistent with regard to the amount of effort they expressed that was needed to retrain staff. And that this staff training issue and getting staff to all do the same thing when patients arrived at their facility, that was a really key aspect in all of this. And that was an incredibly consistent theme across all of the people we talked with.
Great, thanks. Don't forget, everybody, make sure you type your questions in. And are there any questions that y'all would like to ask of our attendees, or anything, other information that you would like to share or express, or any ways specifically that WEDI could help with this effort?
I guess my only question that I have, honestly, for people on the phone is, like Tom pointed out, this, the state, we talked with a lot of stakeholders, but it's obviously not representative. I'd be curious to know if anything that we talked about people, disagreed with in terms of their experience, or conversely, do they find this to be consistent with their experiences around patient matching? Kind of a big question, but.
And while we wait for those responses to come in, we did have a question at the beginning, just some more background information on the, how this report was started, what the initial questions were, just some more background information on the report itself, and then also some more background information on y'all, our wonderful presenters.
I don't know, Jess, you can jump in if I leave out. So I mean, the overall background information is, GAO, we do work in a variety of different areas, and we get our work in a variety of different ways. We get them through, mandates or congressional requests, or by Comptroller General Authority. This was a mandate. So, the background of us doing this work was that it was mandated, and it was one of at least what really seemed almost like a series of reports that were kind of related to health IT in one way or another, due to the congressional interest in the area. We did not come into this work as health IT experts. We studied the issue and talked to a lot of people who are experts and collect the information and report it. But so in this case, it was 21st Century Cures, and then we develop our reporting objectives based on what the mandate asked us look at, and that's kind of how we arrived at what we covered in this report. I don't know, Jess or Andrew, if you want to add anything to that.
No, I think I don't know if people understand GAO. I realize I skipped over that at the beginning. So in terms of our work, as Tom said, I mean, across the entirety of GAO, we have 13 mission teams, and we cover every dollar in every sort of program that is involving federal funds. And so healthcare has some broad areas we work in, including health IT, but also Medicare, Medicaid, VA, DoD healthcare, Indian Health Service, everything that is part of the healthcare system we look at. But we are sort of driven by what Congress wants us to do in terms of either mandating work or requesting work, and it's sort of driven by whatever their legislative agenda is and what their interests are. So I don't know if that helps in terms of giving more background on GAO.
Yes, thank you for further explaining, who you guys are, and then also the purpose of this project. And we haven't had any more questions come in. Is there anything else that y'all would like to address or share with us?
I think Tom's point earlier that we may be reaching back to your members at some point in time when we have additional work that Congress is asking for. We find it very useful to talk to your members. So.
We appreciate that, and we certainly enjoy talking to you and helping you in any way that we can. So thank you for joining us for today's webinar and sharing your lovely faces on the webcam. It's always great whenever we can see who we're talking to, and we really appreciate that. Thank you again for joining us, and thank you to all of our attendees for joining today's webinar as well. I'll be following up with an email with the link to the recorded webinar in case you'd like to share it with your colleagues. So thank you again, everyone, for joining us today, and I hope the rest of your week is great.
Well, thank you very much. We appreciate it.
Thank you.